I'm Jen Carlman with InLab News. We are here in the back green room of the TCA Quick Pitch. This is the fourth year this has been going on. I'm with David Schuster. He is from Nudge RX. So I'm very curious about the name of your company. Tell me about what you do.
Thank you, Jen. Well, Nudge RX is an interesting company. We are in the medical adherence space.
Okay.
So basically what we do, and thus the genesis of the name, is we nudge people to being compliant to their discharge protocol after they've had surgery.
Huh. Okay, so there must be some sort of market out there for this. Tell me, and develop it a little bit more for me.
It is actually a very big problem in the United States. It is the #1 driving point from Medicare and most health insurance companies to control hospital readmissions. Hospital readmissions is about a $56 billion a year problem, of which $39 billion is deemed preventable. If you have surgery today in the United States, you have an 18 to 20% chance you'll readmit in 30 days, and you have a 34% chance you'll readmit in 90 days. And it's all due to the fact that after someone's had surgery, they don't follow that discharge protocol. So they don't take their medications, they are not going to the bathroom correctly, they're not mobile, and maybe they have a sign of depression, and again, they're not taking care of themselves. So they get sick and they end up going back into the hospital through the ER and cost a significant amount of money to the health system.
Right. So obviously, I mean, in just those statistics, the stage for a solution is obviously there. I mean, there needs to be a solution. So tell me more about your product, or what is the solution?
So our solution is basically we hold the patient's hands for a period of 90 days. And we do this with technology using email, text messaging, automated phone calls, live phone calls from an RN, which is 24/7 nursing support, all driving them back to a web environment where they have their customized page that sees how they're going along their progress for that 90 days. And not only do we integrate with the patient, but we're also working with their caregiver. So their family member or their spouse, we involve in that process. So if you take, for instance, someone that is not necessarily tech savvy.
You answered my next question.
So it's a question we get. Someone's not necessarily tech savvy. So for instance, a grandmother, grandfather, something like that.
Right.
That they probably have access to a telephone, but then again, they also have a family member somewhere that has
probably is
the same
tech-savvy.
technology. So they'll do it for them. They'll enter on the internet or the text messaging. But better yet, since we involve them in the system, if through our calling a grandmother we're not getting a response that she's not taking her medication, we then are going to bother the grandparent, the daughter or the father, whomever, saying, hey, look, your grandmother hasn't heard from her. Is she doing well? Right.
Very fascinating idea. Have you tested this? I mean, assuming obviously you probably have tested this on the market, but what has been the response so far in the ease of people following your sort of web protocol and things like that? How do you keep track and know that they're really following it, not just saying, oh yeah, David, we're doing it?
Well, actually, there's to answer your question, two answers. Is that one, we know if someone's using a system or not, because by their response, if they're not responding to our queries that we're sending to them, then we know we have zero response.
Right.
So we know if it's working in that sense. And so then we're able to alert, again, the physician and the family member that we're not hearing back from them. So that's all driven off the fact that they don't responding to a text message or an email or a phone call. How we've tested the system, we've been fortunate enough that we actually have received IRB approval, and IRB is an institutional review board with Sharp Healthcare. And Sharp Healthcare is the #1 health system in in California and #6 in the United States.
Wow.
And we're doing a pilot with them for coronary artery bypass graft and heart valve replacement. And we'll be starting that hopefully at the end of this month, beginning of next month. And those are going to be our true demo pilot.
Right.
And we've also done a series of patient interviews. And we've interviewed all ethnicities, demographics, age levels, and it's been extremely well received. And we sell our program to health insurance companies, but what was probably the most surprising thing we got from our patient interviews is they all were willing to pay for it themselves.
Really? Because they just want that hand-holding, as you described.
Exactly. They're scared when they go home from the hospital. Though someone sat down and walked through them what they need to do, you're recovering from anesthesia, your family member is terrified, you're coming home, so you really don't pay attention to it. So you're given this packet of information.
Right.
And you don't really know what to do. So imagine it's 2 o'clock in the morning and your chest is pounding. And you're 3 days out of the hospital and you've had this major incision, and the only way you can breathe is by holding a pillow against your chest because it hurts so bad. What are you going to do? You may go to the ER and if you have a heart surgery, you immediately get admitted in the hospital if you go to the ER. Versus that's a common pain that someone may feel.
Right.
And so we'll do a quick assessment with them online or on the phone and tell them they're doing okay.
Huh.
And tell them to call their doctor in the morning.
What a cool concept. I love it. Nudge RX. David Schuster, are you the founder, CEO of the company?
I am the CEO and one of the co-founders.
Oh, well, congratulations. Best of luck to you. I think it certainly could revolutionize the medical industry. And if we can save some taxpayer dollars, I'm all about that.
That's the goal. Thank you very much,
David,
Jen.
thanks.